Have you ever woken up in the middle of the night with your heart pounding out of nowhere? Maybe it skipped a beat or fluttered for just a moment. You sat there, hand on your chest, thinking, it's probably just stress. But what if it's not? What if your heart was trying to tell you something and you didn't listen? Welcome to Age Stronger, where we don't just talk about health. We help you take control of it one heartbeat at a time. Here, we don't scare you, we empower you. Because knowing the difference between what's normal and what's not could change your life. In today's video, I'm going to walk you through 3 signs your heartbeat might not be as harmless as you think. And if you're over 50, this is especially important because this is the age when silent atrial fibrillation, dangerous ventricular rhythms, and even heart blocks can show up without warning. You'll also discover a simple at-home device that could literally save your life. How to tell the difference between stress-related flutters and stroke-level danger. And why your heart isn't just... Before we dive in, please hit that like button, share this with someone you care about, and subscribe to Age Stronger so you never miss a life-saving tip designed for you and your loved ones. Now let's jump into today's video and listen to what your heart's been trying to say. What is an arrhythmia? To understand what an arrhythmia is, it helps to first know how a normal heartbeat works. In a healthy adult at rest, the heart typically beats between 60 and 100 times per minute. This rhythm is controlled by the heart's natural electrical system, starting in the sinoatrial (SA) node, a small cluster of cells in the right atrium. This node acts as the heart's internal pacemaker, sending out electrical impulses that trigger each heartbeat in a steady, coordinated pattern to pump blood effectively throughout the body. When this electrical system is disrupted, whether from internal dysfunction or external factors, the heart may beat too fast, too slow, or in an irregular pattern. This condition is called an arrhythmia. Depending on its type and severity, an arrhythmia can be completely harmless or potentially life-threatening. Common types of arrhythmias. Arrhythmias are generally categorized based on the speed and pattern. 1. Tachycardia, fast heart rate. When the heart beats faster than 100 beats per minute at rest, it's called tachycardia. While a faster heart rate can be normal during exercise or fever, it becomes concerning when it happens without a clear cause, especially if accompanied by symptoms like palpitations, dizziness, or chest discomfort. Common types include supraventricular tachycardia, SVT, originates above the ventricles, often causes a rapid, pounding heartbeat. Ventricular tachycardia, VT, begins in the ventricles and can lead to ventricular fibrillation, a medical emergency that may cause sudden cardiac arrest if not treated immediately. 2. Bradycardia, slow heart rate. A resting heart rate below 60 beats per minute is known as bradycardia. While athletes may have slow heart rates and still be perfectly healthy, in others it can cause fatigue, shortness of breath, dizziness, or even fainting. Bradycardia can result from a malfunctioning SA node or from impaired electrical signals between the heart's chambers, a condition known as atrioventricular AV block. 3. Atrial fibrillation, AFib. AFib is the most common arrhythmia, especially in older adults. Instead of contracting in a coordinated way, the atria quiver erratically, leading to poor blood flow. This increases the risk of blood clots, which can travel to the brain and cause a stroke. Some people with AFib have no symptoms, while others may feel a rapid heartbeat, fatigue, or difficulty breathing. 4. Premature beats. These are extra heartbeats that occur earlier than normal, often felt as a skipped beat or flutter. Most premature beats are harmless, but frequent episodes may signal an underlying heart issue and should be evaluated. 5. Ventricular fibrillation, VFib. This is a medical emergency where the ventricles quiver instead of pumping blood, causing the heart to stop. without immediate defibrillation, an electric shock. 6. Atrioventricular AV block. AV block occurs when the electrical signals from the atria don't properly reach the ventricles. It's classified by degrees: first degree, delayed transmission; second degree, occasional missed beats. Degree, complete block, often requires a permanent pacemaker to maintain a safe heart rate. Causes of arrhythmias. Arrhythmias can be triggered by a wide range of factors, some benign, others more serious, underlying heart conditions, such as coronary artery disease, heart failure, myocarditis, or valve disorders; emotional stress, anxiety, and sleep deprivation, which can overstimulate the sympathetic nervous system and trigger abnormal heart rhythms; electrolyte imbalances, particularly involving potassium, sodium, calcium, or magnesium, which are essential for electrical signaling in the heart; medications or stimulants, including over-the-counter cold medicines, antidepressants, asthma drugs, caffeine, and nicotine; thyroid disorders, especially hyperthyroidism, which can cause sustained fast heart rates; alcohol or recreational drugs. Excessive use can disrupt the heart's electrical system, and understanding the different types of arrhythmias and their underlying causes empowers patients and their families to recognize warning signs early. Timely detection and appropriate care can significantly reduce the risk of serious complications such as stroke, heart failure, or sudden cardiac arrest. Recognizing that not all irregular heartbeats are harmless is the first step in protecting your heart and your life. When is an arrhythmia dangerous? Not every skipped beat or rapid heartbeat signals a serious problem. It's common to feel your heart race after stress or emotional excitement without it being harmful. However, in some cases, arrhythmias can be early warnings of major cardiovascular events like stroke, heart failure, or even sudden cardiac arrest. The key is knowing 1. Warning signs you should never ignore. Some symptoms may seem mild at first, but they could indicate that the heart is struggling to function properly due to an abnormal rhythm. These include shortness of breath, especially with minimal exertion, may signal reduced blood flow from the heart; chest pain or discomfort, a squeezing, pressure-like, or burning sensation could point to a heart attack; dizziness or lightheadedness, caused by decreased blood supply to the brain, often due to arrhythmias; fainting, syncope, one of the most serious symptoms, possibly due to a pause in heart activity from complete heart block or ventricular fibrillation; rapid or irregular heartbeats, especially if they happen frequently or come with anxiety, fatigue, or discomfort. If you experience any of these, especially if you have existing heart disease or are over 60, prompt evaluation by a cardiologist. 2. When heart rate is too fast or too slow. Everyone's resting heart rate is a little different, but there are thresholds that raise red flags. Heart rate over 150 beats per minute at rest. This level of tachycardia reduces the heart's ability to fill and pump blood efficiently. It can lead to low blood pressure, dizziness, or even acute heart failure. Heart rate under 40 beats per minute, especially with fatigue, confusion, or fainting, may suggest serious conduction issues like AV block or sinus node dysfunction. These cases often require a pacemaker to maintain adequate heart rhythm. According to Mayo Clinic, arrhythmias that are too fast or too slow for the body to compensate are among the top triggers of sudden cardiac arrest and long-term heart muscle damage. 3. When arrhythmias occur with underlying conditions. Arrhythmias are far more concerning when they occur alongside other health issues. Heart failure. When the heart is already weakened, any irregular rhythm, fast or slow, can tip the balance, leading to fluid buildup, worsened symptoms, or even a medical emergency. Coronary artery disease, CAD. Arrhythmias can indicate poor blood flow to the heart muscle. If untreated, this can cause a heart attack or death, high blood pressure, and diabetes. These conditions damage blood vessels and the heart's electrical system over time, making arrhythmias more likely and more dangerous. History of stroke or blood clots. Atrial fibrillation, AFib, significantly increases the risk of new clot formation, which why atrial fibrillation, AFib, deserves special attention. AFib is the most common type of arrhythmia, especially in people over 65. Instead of beating in a coordinated way, the atria quiver at a rate of 300–600 times per minute. This chaotic motion reduces blood flow and increases the chance of blood pooling, particularly in the left atrial appendage, where clots can form. If a clot travels from the heart to the brain, it can cause a stroke. According to Cleveland Clinic, AFib increases the risk of stroke by up to 5 times compared to people with normal rhythm. But AFib's risks go beyond stroke. It can weaken the heart over time, leading to heart failure. It often causes exercise intolerance, making daily activities more difficult. It increases hospitalizations and mortality in older adults. That's why treatment for AFib involves not just controlling the heart rate or rhythm, but also preventing blood clots with anticoagulants. 5. What the research and guidelines say. According to Harvard Health Publishing, certain arrhythmias, like ventricular fibrillation, ventricular tachycardia, degree heart block, and uncontrolled AFib, are among the most dangerous heart conditions, often leading to sudden cardiac death if untreated. Mayo Clinic emphasizes, not all arrhythmias are dangerous, but ignoring symptoms or delaying treatment is what makes them deadly. Cardiologists recommend that adults over 60 undergo regular ECG screenings, especially those with high blood pressure, valvular disease, or a family history of AFib or sudden cardiac death. Ultimately, the danger of an arrhythmia isn't just in the heart rate displayed on a screen, it's in the context, your symptoms, medical history, and how well your heart is tolerating the rhythm. The difference between a minor arrhythmia and a life-threatening one often comes down to early detection and timely treatment. Recognizing the signs and acting on them can save. How to detect an arrhythmia early. Heart rhythm disorders, or arrhythmias, don't always come with obvious warning signs. Some people may feel an occasional missed beat during stress or excitement, while others may have no symptoms at all until a serious complication like a stroke or fainting occurs. That's why early detection plays a crucial role in preventing potentially life-threatening events. How to monitor your heart rhythm at home. Keeping track of your heart rate regularly is a simple yet powerful way to catch early signs of an irregular heartbeat. Manual pulse check. Place 2 fingers on the inside of your wrist or just under your jawline, carotid artery. Count the number of beats for 60 seconds. A normal resting heart rate typically falls between 60–100 beats per minute. If your pulse is consistently too fast, too slow, or irregular, it's time to follow up. Digital blood pressure monitors. Many home monitors now include arrhythmia detection. If the device shows a warning for irregular rhythm or your readings, smartwatches and fitness trackers, devices like the Apple Watch, Fitbit, and Samsung Galaxy Watch can continuously track your heart rate throughout the day. Some even offer notifications for irregular rhythms or signs of atrial fibrillation, AFib. While not a substitute for a clinical diagnosis, these tools can alert users to potential issues early, especially helpful for older adults or those with a history of heart disease. Though these at-home tools aren't diagnostic, they can serve as early warning systems, helping you recognize when something's off and prompting you to seek care. Common medical tests for arrhythmias. If your doctor suspects an arrhythmia, they may recommend one or more of the following diagnostic tests. ECG electrocardiogram. This is usually the first and most basic test. It records the electrical activity of your heart via electrodes placed on your chest, arms, and legs. An ECG can identify 24-hour Holter monitor, a portable device worn on your body for 24 to 48 hours, continuously recording your heart's activity as you go about daily life. This test is especially useful if your symptoms are infrequent and don't show up during a standard ECG. Electrophysiology study, EPS, a more advanced test performed in a specialized cardiac center. A thin catheter is inserted through a vein, usually in the groin, and guided into the heart to precisely map electrical signals. If an arrhythmia source is found, catheter ablation may be performed during the same procedure to eliminate the problem area. When to see a cardiologist? Immediately. You should seek medical attention from a cardiologist as soon as possible if you experience a racing or irregular heartbeat that lasts more than a few minutes, especially at rest or without exertion. Frequent dizziness, lightheadedness, or shortness of breath without an obvious cause. Episodes of fainting or feeling like you might pass out. A resting heart rate consistently above 100 or below 50 BPM, especially if paired with fatigue or confusion. A previous diagnosis of AFib, heart block, or an unexplained stroke or blood clot. Repeated irregular readings from a smartwatch or digital monitor that don't return to normal. Also, if you have underlying conditions like high blood pressure, diabetes, valve disease, or are taking medications that affect the heart's electrical system, regular checkups, even in the absence of symptoms, are strongly advised. Why early detection matters. Catching an arrhythmia early allows for timely treatment, potentially preventing stroke, heart failure, or sudden cardiac events. In many cases, early intervention can restore normal rhythm, reduce long-term damage, and vastly improve quality of life. For middle-aged and older adults, especially those with cardiovascular risk factors, staying proactive with heart monitoring is a smart and potentially life-saving habit. The earlier you spot an issue, the better your chance to treat it before it becomes dangerous. Common mistakes and critical warnings about arrhythmias. In cardiology clinics, many doctors have seen cases where the greatest concern wasn't just the arrhythmia itself, but how the patient tried to handle it before seeking care. Misunderstandings, overconfidence, and poor advice from non-medical sources often lead to complications that could have been avoided. Here are 3 of the most common and dangerous mistakes people make, along with expert advice on how to avoid them. Mistake 1: assuming it's just anxiety. Yes, emotional stress can make your heart race, but not all fast heartbeats are caused by anxiety. In fact, many people with serious conditions, like atrial fibrillation, AFib, supraventricular tachycardia, SVT, or even the early stages of ventricular fibrillation, dismiss their symptoms as stress-related and delay getting help. If you're middle-aged or older and notice episodes of racing heartbeats along with chest discomfort, shortness of breath, or dizziness, brushing it off as nerves can be dangerous. According to Mayo Clinic, up to 30–40% of people with chronic AFib go undiagnosed because they assume their symptoms are just anxiety. Expert tip: if your heart starts beating abnormally fast or irregularly, and it happens more than once, don't just try to calm yourself down and wait it out. A quick visit to your doctor for an ECG or 24-hour Holter monitor could detect a potentially serious arrhythmia early, before it leads to stroke or heart failure. Mistake 2: taking sedatives on your own to slow the heart. One surprisingly common but dangerous habit is self-medicating with sedatives, like diazepam, alprazolam, or over-the-counter sleep aids, hoping to calm the heart. This approach may seem harmless, but it can backfire quickly. Sedatives can lower blood pressure and slow the heart rate, but they don't address the root cause of the arrhythmia. Worse, if you already have a condition like mild heart block or naturally slow heart rhythms, sedatives may push your heart rate dangerously low, leading to fainting or even cardiac arrest. Expert tip: never take sedatives without a prescription, especially if you have heart symptoms. If you're feeling anxious and suspect it's affecting your heart, see a cardiologist or psychiatrist. There are safer ways to manage anxiety, and doctors can prescribe medications that won't endanger your heart rhythm. Self-medicating for comfort can land you in the emergency room. Mistake 3: ignoring underlying conditions like high blood pressure or diabetes. Some people treat arrhythmias like a standalone issue, separate from their other health problems. But in reality, underlying chronic conditions, such as hypertension, diabetes, thyroid disorders, or heart failure, can either trigger or worsen arrhythmias. For example, long-term high blood pressure can stretch and damage the heart's chambers, increasing the risk of AFib. Diabetes harms the small blood vessels and the heart's electrical system, making rhythm disturbances more likely. Hyperthyroidism can cause persistently high heart rates that lead to AFib. Heart failure weakens the heart and alters the way electrical signals move through it, increasing the risk of dangerous arrhythmias. Expert tip: managing your underlying conditions is one of the most powerful ways to prevent arrhythmias and reduce your risk of complications like stroke or sudden cardiac death. Follow your treatment plan, take your medications as prescribed, and keep up with your routine checkups. These common missteps might seem minor at first, but they can have serious consequences. The key to keeping your heartbeat and your life on the right track is to stay informed, act early, and never treat heart symptoms lightly. Don't rely on guesswork, home remedies, or online tips. When it comes to your heart, getting the right care at the right time could save your life. Treating arrhythmias: no one-size-fits-all approach. There is no universal treatment for arrhythmias. Each person's condition is unique and must be evaluated individually based on the type of arrhythmia, severity of symptoms, underlying health issues, and overall heart function. Treatment options may include medication, interventional procedures, or a team-based care model involving multiple specialties to achieve the best outcomes. 1. Antiarrhythmic drugs. These medications act directly on the heart's electrical system to restore normal rhythm. Common options include amiodarone, flecainide, and sotalol, often prescribed for tachycardia, atrial fibrillation AFib, or frequent premature beats. However, antiarrhythmic drugs must be used carefully, as they can cause serious side effects, including thyroid, lung, or liver problems, and in some cases may worsen arrhythmias if misused or not properly monitored. 2. Rate control medications. In many cases, especially with chronic AFib, the goal isn't to restore normal rhythm, but to slow the heart rate so it pumps more efficiently. Medications like beta blockers, e.g. metoprolol, bisoprolol, calcium channel blockers, e.g. diltiazem, verapamil, and digoxin, are used to keep resting heart rate below 100 beats per minute. 3. Anticoagulants, blood thinners. These are essential for many patients with atrial fibrillation, which increases the risk of blood clots and stroke. Long-term anticoagulation helps prevent clot formation in the atria. Options include warfarin, dabigatran, rivaroxaban, and apixaban. The right choice depends on factors like age, kidney function, bleeding risk, and non-medication treatment options. Cardioversion, electrical shock therapy. This controlled procedure uses an electric shock to reset the heart to a normal rhythm. It's commonly used for newly diagnosed AFib or sudden onset tachycardias. Cardioversion is performed in a hospital under short-term sedation and close monitoring. Pacemaker implantation. Pacemakers are used for patients with very slow heart rates, advanced heart block, or sick sinus syndrome. The device is implanted under the skin in the chest and connects to the heart via tiny wires. Catheter ablation. One of the most effective modern treatments, catheter ablation is ideal for people with arrhythmias that don't respond well to medication, particularly AFib or certain types of tachycardia. In this procedure, doctors insert a catheter into the heart through a vein, usually in the leg, map the problem area, and then destroy the abnormal tissue using heat or cold. In some cases, this method can eliminate the arrhythmia completely. Multidisciplinary team managing arrhythmias often requires more than just a cardiologist. The best results come from a coordinated team approach. Cardiologist leads the diagnosis, treatment planning, and monitoring of heart rhythm. Primary care physician or internist helps manage chronic conditions that contribute to arrhythmias, such as high blood pressure, diabetes, or metabolic disorders. Mental health professional supports patients experiencing anxiety, depression, or insomnia, which can worsen arrhythmias or trigger episodes. Clinical pharmacist monitors for drug interactions. Why personalized care matters. Successful treatment of arrhythmia depends not just on medication or procedures, but on how well a treatment plan fits each individual's lifestyle, medical history, and emotional health. By personalizing care and involving the right specialists, patients are more likely to avoid relapses, improve quality of life, and prevent life-threatening complications like stroke or sudden cardiac arrest. Every heart has its own story. That's why treatment should be as unique as the person behind it, flexible, thoughtful, and tailored to each patient's needs. Lifestyle and long-term prevention. Keeping arrhythmias from coming back. Even after successful treatment, arrhythmias can return, especially if lifestyle habits aren't adjusted or health isn't managed properly. Building heart-healthy routines not only helps stabilize your heartbeat, but also boosts medication effectiveness, reduces complications. Smart eating, less salt, cut the caffeine, and quit smoking. Your diet plays a key role in regulating blood pressure, maintaining electrolyte balance, and reducing heart stimulation. Watch the salt. A high-sodium diet raises blood pressure, causes fluid retention, and adds stress on the heart, especially in people with heart failure or atrial fibrillation. Choose fresh foods over canned or processed options, which are often loaded with sodium. Ease up on caffeine. Not everyone with arrhythmias needs to avoid coffee completely. But if you notice symptoms like palpitations or a racing heart after drinking coffee, tea, energy drinks, or eating chocolate, you might be caffeine sensitive. Try limiting your intake or switching to caffeine-free alternatives. No smoking. Nicotine causes blood vessels to constrict, stimulates your sympathetic nervous system, and raises both heart rate and blood pressure. Smoking also reduces the effectiveness of heart medications and increases the risk of complications like heart attacks or dangerous arrhythmias. Exercise, but don't overdo it. Moderate physical activity is one of the best ways to support heart health, manage blood pressure, relieve stress, and improve circulation. But if you've had an arrhythmia, it's important to exercise wisely. Avoid high-intensity workouts unless cleared by your cardiologist. Focus on low to moderate-intensity activities like brisk walking, swimming, biking at a gentle pace, or restorative yoga. Always listen to your body. If you feel dizzy, short of breath, or notice irregular heartbeats during exercise, stop and speak with your doctor. The American Heart Association recommends about 30 minutes of moderate activity, 5 days a week for most heart patients. Manage stress. It matters more than you think. Mental and emotional stress often gets overlooked, but it has a real impact on your heart rhythm. Ongoing anxiety, poor sleep, or depression can stimulate your sympathetic nervous system, increasing heart rate and triggering arrhythmias. Some effective stress management strategies include meditation and deep breathing, calms your nervous system and steadies your heart rate. Gentle yoga combines physical relaxation with mental focus. Cognitive behavioral therapy, CBT, especially helpful if you're struggling with worry or mood changes after a heart diagnosis. Good sleep hygiene. Aim for 7-8 hours per night. Follow-up visits and medication compliance. Arrhythmias rarely just go away. Even after treatment, regular follow-up is essential to monitor how you're doing and make adjustments if needed. Your doctor may perform repeat ECGs, review any new symptoms, or check for medication side effects. Taking your medication exactly as prescribed, including antiarrhythmics, rate controllers, and blood thinners, is non-negotiable. Skipping doses or stopping early increases your risk of serious complications like stroke or heart failure. It's a good idea to keep a symptom diary noting things like heart fluttering, skipped beats, fatigue, or shortness of breath, and share it with your doctor during checkups. A healthy heart isn't just about pills or procedures, it's something you build daily through mindful choices, routine care, and taking responsibility for your own well-being. By living intentionally, you give your heart the best chance to beat strong and steady for years to come. Not having an irregular heartbeat doesn't always mean you're in immediate danger. In fact, many people live their entire lives with certain types of arrhythmias without ever experiencing serious complications. But the real risk often lies in the unknown, those subtle, early signs that get overlooked or brushed off as nothing serious. The goal isn't to panic or obsessively check your pulse every hour. It's about being in tune with your body and knowing when something isn't right. A racing heartbeat without a clear reason, persistent palpitations, dizziness, shortness of breath, or even fainting, these are all red flags that should never be ignored. The key is acting at the right time. Sometimes it's as simple as scheduling a routine heart checkup, getting a quick EKG, or wearing a smartwatch that tracks your heart rhythm. If you've already been diagnosed, managing your arrhythmia goes beyond just taking medication. It includes sticking to your treatment plan, embracing a heart-healthy lifestyle, managing stress, and keeping any underlying conditions like high blood pressure or diabetes in check. But here's the bigger picture. Heart rhythm issues aren't just about the heart. They're about how you live, how you feel, how you take care of yourself every single day. A steady heartbeat is closely connected to a calm mind, healthy habits, and supportive relationships. You can't separate one from the other. Living well with a stable heart rhythm isn't an unreachable goal. It starts with awareness, mindfulness, and taking responsibility for your health. Sometimes, just one skipped beat is enough to remind us that our health is fragile and deeply precious. Listening to your heart doesn't just mean hearing it, it means paying attention to it, caring for it. And so after everything we've shared, how's your heart feeling now? Maybe you're wondering, that flutter I felt last week, was it just stress or a sign I missed? Here's the truth, not every irregular heartbeat means danger. But none should be ignored. Some arrhythmias are harmless companions. Others are silent threats that only speak once. The key isn't fear, it's awareness, it's listening, and most of all, it's know. At Age Stronger, we believe heart health isn't just about medication or checkups. It's about staying informed, staying proactive, and living each day with clarity and confidence. If this video gave you a fresh perspective, we'd love your support. Don't forget to like, share, and subscribe to help us grow and bring you even more helpful content. And remember, your heart speaks. Sometimes with strength, sometimes with a whisper. Don't wait for the shout. This is Age Stronger, where knowledge beats fear and action beats regret. Thanks for watching, and